everyone. This is Chris Croft, Prevention Education Program Manager with the North Carolina Coalition Against Sexual Assault, and I'm joined here today by Madison Van Epps, who I can't wait to introduce you to. I am grateful to have you here. I want to just call your attention to a few technical things. One is that in the chat, you can send chats either to just the panelists, which is me and Madison. So if you have a question or concern you just wanted to raise to the two of us, you could say, use that drop-down box and select all panelists to send a chat just to the two of us. If you wanted to send a chat that went to the whole group, which I want to encourage y'all to feel free to share information and ideas and feedback in the chat, you can select on that drop-down all panelists and attendees. And that way y'all can sort of respond to each other and have dialogue in the chat. There will be a few places, there's at least one place in this webinar where you'll have a chance to sort of share some of your ideas in the chat, and I'm very excited to have y'all here for this this session. And I know Madison is going to tell you a little bit more about this project during her intro, but I wanted to tell you how I came to work with Madison, which is that Madison is an MPH student at UNC Chapel Hill, and did her practicum with us last summer, and we realized through the work of some of our statewide groups that there was a need for some sort of document that would help people know what kind of human trafficking curricula were out there and being used in North Carolina, and how they could kind of in one place have information to see criteria about each of those curricula that could help you make an informed decision. And so Madison did pretty much all the work on this. This was Madison's project, and Madison did an amazing job, and I was just honored to get to be to work with Madison on this practicum. So I'm going to go ahead and start sharing my screen. Oh, also I wanted to point out that if you wanted to raise your hand, if you have participants open, somewhere at the bottom of your screen, you may have something you can click on to raise your hand. Did you want to try doing that? You can raise your hand and you can lower your hand. And so that pops you up in our field as someone who might have a question to ask. And we can, throughout this webinar, if we need to, call on you if you don't feel comfortable putting your question in the chat, or if you have something that maybe we want you to explain more, you can always raise your hand to get our attention, to pause what we're doing to see what the questions are. So I'm going to go ahead and share my screen and tell you a little bit about NCCASA. So the North Carolina Coalition Against Sexual Assault is an inclusive statewide alliance working to end sexual violence through education, advocacy, and legislation. We use a social justice framework in everything that we do. We try to do our work from a strong intersectional lens. We know that when we do not center marginalized communities in our work, that their needs do not get met and their voices are not heard. So we do our best to center our work around marginalized communities to make sure that everyone gets served. At the beginning of every single one of our trainings, we acknowledge that not all women are victims, not all men are perpetrators, and that anyone of any gender can be a victim or a perpetrator. And we know that's true for human trafficking as well as sexual violence that occurs either in the context of trafficking or in other forms. We want our work to be inclusive. We want to make sure that people do not feel invisible in our work and that we don't leave anyone behind. And at this point, I think I'm going to turn it over to Madison to go ahead and share. And I will be here to kind of help out in the chat, and we'll occasionally chime in with some discussion stuff with Madison. But Madison, it's all you.
Thank you, Chris. Good morning, everyone. I want to first thank you all for joining our webinar today for how to choose a human trafficking prevention curriculum. Today we'll be discussing the resource that Chris told you about, the Human Trafficking Prevention Curriculum Matrix, which is a tool to help North Carolina schools identify the best prevention curriculum for their district. My name is Madison Van Epps, and I'm going to be your presenter today. Here's a brief overview of our agenda for the day. We're going to start by taking the time to understand the need for the curriculum matrix and why it is an important resource for North Carolina schools. We will discuss the steps that led to the creation of the matrix through conversation with representatives of North Carolina school districts and individuals at anti-trafficking organizations that currently have a prevention curriculum. We will break down the sections of the matrix, looking at the three main sections and identifying important highlights from the review and lessons learned. And lastly, we will take time to open the human trafficking prevention curriculum matrix and walk through it and discuss how it can be utilized by North Carolina schools to compare the prevention curriculum and make an informed decision for their district. So we're going to start today with a poll. I want to know a little bit more about who's attending today's session and where everyone is coming from.
And I am going to intervene here and say that my poll is not launching. So why don't we start with these questions. If you want it in the chat, to go ahead and share it in the chat. If you want to name what kind of agency you work for, are you at a rape crisis center or a dual DV agency, a human trafficking agency, law enforcement, a school? So if you don't mind sharing what kind of agency you're at, what your position is at your agency. Are you a direct services advocate? Are you a prevention educator? Are you a teacher or administrator? And then also some of you in your introduction earlier shared where your agency was, but I would love to invite you to share with us where you're joining us from. Are you in North Carolina? And are you in, or are you at a different state? And some of you that already answered that in the chat, that is fine. We just kind of want to get in your introduction, that's fine. We just wanted to get a feel for kind of where you're coming from and what the breakdown of kinds of agencies we have on here are. So I'm seeing some health and hospital systems. I'm seeing some at the Safe Center, which I know is a trafficking group. I'm seeing rape crisis prevention educators in here. Dual agencies here in North Carolina. All right, and I'm seeing a human trafficking agency in Chicago, dual DV in Buffalo. More from Maryland. Thank you for sharing these. I'm just trying to get a feel for where you're all coming from. It looks like we have a mix of North Carolina and out-of-state people. Someone I'm guessing maybe from Tippy here at North Carolina DHHS. All right. Perfect.
Thank you,
Yeah.
everyone, for
and
sharing.
If you haven't responded yet, feel free to keep adding that into the chat. That'll just help us kind of have an idea of who the mix of people are on this webinar.
As we can see, we have a variety of experiences and knowledge here, so I want to welcome everyone to leave comments in the chat as they arise during the presentation or ask questions if you have them. I want today's session to be more of a dialogue or a conversation, so please feel free to chime in the chat. In today's introduction, I want to share a little bit about me and how I came to be involved with work at NCCASA, and we will also introduce ourselves to Session Law 2015-279. I think it's important to ground ourselves in why we needed this resource and how this project came about in North Carolina. So as I said, my name is Madison Van Epps and I use she, her pronouns. I'm originally from a really small town in Michigan named Owasso, Michigan, and I graduated from the University of Michigan in 2019 with a bachelor's in community and global health from the School of Public Health. In public health work, we often discuss how important it is to be involved in communities and how different communities or locations can have a drastic effect on health opportunities and health outcomes. So after spending 22 years in Michigan, it was really important to me to attend a graduate school that was outside of where I had been my whole life, and live in a new community and work in a new location so that I could look at public health in a new lens. I'm now about to graduate in May from the Gilling School of Global Public Health at the University of North Carolina in Chapel Hill, and my Master's of Public Health has a concentration focus on maternal, child, and family health. Beyond being a student at UNC, I am a nanny for a family in Chapel Hill. I also work part-time as a social media content creator for a local family sleep consultant. And as Chris said, I'm working this semester with NCCASA to deliver a handful of trainings in relation to the anti-trafficking movement. I'm currently completing my thesis, which is a review suggestions for the future of practice, policy, and research regarding the impact of social media consumption on the body image of adolescent girls in the US. And I'm also looking for postgraduate jobs. So I kept my last semester of graduate school very busy. To understand the need for this project, I wanted to take a look at Session Law 2015-279. In 2015, the North Carolina General Legislature passed Session Law 2015-279, mandating the inclusion of sex trafficking prevention education and reproductive health education in North Carolina schools. Here I have included that the language that was utilized in the mandate. The mandate required that school administrations collaborate with a diverse group of outside consultants where practical, including law enforcement with expertise in sex trafficking prevention education, to address the threats of sex trafficking, and also create a referral protocol for high-risk pupils and minors. Just in this first section of the mandate, we know that at times law enforcement has many roles in the community, and for some, their main focus is not going to be sex trafficking or sexual violence prevention efforts, and that may not be where their knowledge lies. So there can be difficulties in relying on law enforcement as experts and finding those collaborative relationships for school administrations. As well, collaborating with a diverse group of stakeholders to create or find a curriculum has potential barriers such as time or funding. Additionally, this mandate required that the materials be age appropriate and that information must be peer reviewed. They recommend that law enforcement agencies, criminal justice agencies, and non-governmental organizations are potential stakeholders in this collaboration. With that being said, finding age-appropriate curriculum that is also peer-reviewed is a challenge within itself, and especially difficult for a school administration if they do not have proper support or resources. And at this time, there's only one peer-reviewed curriculum, and this curriculum has its own barriers, such as being only for adolescent girls and has high costs associated with training for those delivering the curriculum. And so when the mandate says it needs to be peer reviewed and age appropriate, but we only have one known curriculum, we can see that there's difficulties for schools in finding the resources for completing this mandate. As we'll discuss later in the presentation, there's opportunity to work with curriculum developers about how to become an evidence-based curriculum. And this will actually be a training that I'll be hosting at the biennial conference later this spring. So helping curriculum help school administrations reach this mandate. So just in short, Session Law 2015-279 mandated the inclusion of sex trafficking prevention education and reproductive health education in North Carolina schools. It required that this curriculum be objective and peer reviewed, and it required the development of a referral protocol for cases of disclosed or suspected sex trafficking. And so the main outcome that we'll be discussing today is that, unsurprisingly, after this mandate was enacted in 2015, many schools were and still are unsure of how or where to find human trafficking prevention curriculum, or how to identify which curriculum of those that exist would function best in their classrooms and their school district based on their needs. There are many difficulties with putting a mandate into place when there's not the proper support within a community or adequate resources that would aid school district in being successful in following the mandate.
And I was just going to add something that's really interesting is that a lot of the schools didn't even realize there was a mandate or were confused about the mandate. So there was another mandate passed in 2019 that mandated training school staff and teachers in sex trafficking awareness and prevention. So we found there was some confusion around what to do. So I know Madison will speak to this later, but even when we asked them what curriculum do you use, a lot of them replied with a professional training they provided their teachers, like not realizing that this mandate even required them to teach students. So there is some confusion about how to implement this in North Carolina.
And so the same barriers that I mentioned on the last slide to implementation of this mandate was recognized by the Sexual Violence Prevention Advisory Council, also known as SVPAC. SVPAC is a gathering of statewide professionals in the North Carolina from a variety of public health and education fields that have expertise in violence prevention. Specifically, their K-12 education work group focuses on strengthening sexual violence prevention efforts in primary and secondary education settings. And so after determining the barriers that were inhibiting local school districts from following the mandate, they identified the need for a clear outline of available resources and curriculum that were available for sex trafficking prevention education. This resource would be used to assist local school districts in meeting the mandate by providing relevant logistical and content information from each curriculum to help schools make informed decision about their sex prevention strategy, sex trafficking prevention strategy. And this is where I was put in contact with Chris, and they spoke to me about the need, and that is where my project began. I think it's important before we begin to talk about how I created the matrix. So providing a bit of background information into the development of the matrix so that you can understand the conversations that existed before the matrix and that it was developed with the goals of serving the school district specifically. There were two main aspects in the development of the matrix, which were reaching out to North Carolina schools and then organizations with a known human trafficking prevention curriculum. In reaching out to schools, there were two main goals. One, to assess which curriculum was being used currently within schools throughout the state of North Carolina, and two, just to understand how many schools had followed the mandate, how many schools had already selected a prevention curriculum. In June of 2020, I reached out to North Carolina schools, and I reached out to almost all of the 115 school districts, and about a week later sent a follow-up email. From these two communications, I received a total of 31 responses, which was about a 27% response rate. And for some, this might seem pretty low, but I was actually pretty proud of the number, given that during summer of 2020, schools were deep in focusing on how their response to coronavirus pandemic and creating modes of instruction and facilitating virtual learning. So from these responses, I have a breakdown of some of the responses we received. 5 schools said that they do not have a curriculum. 4 said we discuss it in health classes. 3 said they bring in outside organizations or officials to do training. 8 others had various assorted curriculum that we used to guide our list and those that we reached out to, and 11 used vector safe schools. And this touches on what Chris mentioned when they said that schools may have been unsure what the mandate was requiring, because vector safe schools is actually training for school faculty and teachers and not for students. And so discussion with school districts provided us names of curriculum that we were then able to look at and to contact for the next step in creation of the matrix. This discussion also told us that approximately 16% of respondents had not yet decided on a curriculum, although the mandate was put into place in 2015. And so in those 5 years, this is now demonstrated that school districts need continued support in following this mandate. We then began our curriculum tracking and requests. And so with the goal of receiving survey responses to understand the presence or absence of certain factors, including logistical information and content in a human trafficking prevention curriculum, with the overall goal of including these organizations in a comprehensive matrix. So with the feedback from the contacts at the local school districts, the project team created a list of anti-trafficking organizations that had a known prevention curriculum. We also completed a preliminary web search and reached out to collaborative partners to find additional organizations that were not mentioned by the school districts, but also had a known prevention curriculum. I reached out to 30 different prevention curriculum organizations, and from the initial contact and a follow-up email, we received 14 organizations and their survey responses that wanted to be included in the final matrix. And then the survey responses led to the development of the matrix and its contents. We'll now step into the matrix contents, looking at the matrix by logistical information, the matrix by content, looking at the social ecological model and the risk and protective factors for sex trafficking, and then review highlights and lessons learned. And so this is really going to be a breakdown of the different sections of the actual resource. There are 5 main sections of the prevention curriculum matrix, one being matrix by logistical information. So the methods for developing the content that was included in the curriculum and logistics of implementing the human trafficking prevention curriculum in a school district. 2, matrix by content. So this will be more specific information on specific elements that are taught about in the curriculum and the key information that is targeted within the curriculum. The matrix by risk and protective factors is a list of the factors developed using Teach to Reach's resources for risk factors for experiencing sex trafficking. And then we also included adherence to gender norms and hypermasculinity as they're listed by the CDC as risk factors for sexual violence and received support for inclusion by the project team. And then finally, looking at review highlights and lesson learned for administrators and educators, just overall thoughts that came from completing the project. So the first part of the matrix, as I mentioned, looks at the methods that were used to develop the curriculum and the content in the curriculum, use for developing the content in the curriculum and the logistics of the curriculum in a school district. Questions in this portion of the survey included who delivers the curriculum. And so for schools, this will allow them to see, is this feasible to take this curriculum and implement it into our schools? So who delivers the curriculum? Is it staff? Is it youth? Is it teachers? Is it trained officials? Is it law enforcement? If their goal is to find a curriculum that needs to be taught in health classes, maybe it'd be less feasible that it had to be performed by a trained curriculum developer. Is the intended audience all grade levels? Is it youth? Is it staff? Is it social workers? The format of the lessons looks at, are these videos? Are there guided booklets? Is it videos online? Is it individual lesson plans that a student will click through on their own on their computer? Languages that the curriculum can be offered in. So is it only available in English? Is it available in more than English? For example, in both Mecklenburg and Wake County, just over 25% of residents are Latino. And so maybe for a county with a higher Latino population, it'd be important that they find a curriculum that is offered in Spanish. Are there costs associated with the curriculum? So obviously we can all say that we'd love to provide a matrix that just gave everyone peer-reviewed, free training and curriculum, but unfortunately there are costs associated with some of the curriculum, costs to train the people delivering the program, cost to buy the program. And so it's important for school districts to consider that when deciding if a curriculum would fit best into their health education plan. Is the curriculum gender inclusive? And so in this question, curriculum developers were asked to check all that apply. So is it intended for men, women, non-binary, and other gender identities? Is it inclusive of LGBTQ+ youth with relevant statistics and scenarios? Does it use they, them language as opposed to he, she? Scenarios that represent a variety of gender identities? Is it intended to be taught in mixed gender settings? Is it intended to be taught in gender specific settings? And so this asks curriculum developers to be explicit about the inclusivity of their program. And while evidence demonstrates increased risk of experiencing trafficking among LGBTQ+ individuals because of heightened risk to things such as homelessness or lack of social support, only 7 of the 14 responses indicated that a curriculum is LGBTQ+ inclusive with relevant statistics and inclusive scenarios. And so for schools that wish to highlight inclusivity as one of their prominent factors in choosing a curriculum, this would automatically allow them to know that their options for curriculum have reduced to half. And so specific questions like this allow schools to be explicit in identifying the things that matter to them in their community. Is this curriculum faith-based? Is it, and this was an open-ended question, which led responses to say maybe it wasn't write-in responses from curriculum developers that maybe it wasn't developed with a faith-based lens, but they are not explicit to say that people who are faith-based wouldn't benefit from their program. But for some schools, it might be really important that their curriculum was developed faith-based. And then finally, as mentioned, one of the key components of the mandate is that schools must create or have a protocol for responding to student disclosure. So for some districts, a curriculum that includes recommendations for a protocol development may be necessary in the curriculum itself if the school district does not already have one.
And I was going to add with all of these that this was less of a one of these is right and one of these is wrong. It's more like, what does the school need? Is it going to fit their needs? So there may be a school that is, or a school where their sex trafficking or sexual health education is delivered in gender specific settings. And so then knowing that they had a curriculum that's designed to be taught in gender specific settings would be a good fit for them. Same with the faith-based, that this isn't about one thing being better than the other. It's about making sure it fits the school, the community it's being taught in. I did want to note on the gender inclusive questions that there are different ways that people define their answers. So for example, we did see some people who said, yes, their curriculum was intended for men, women, non-binary, and other gender identities, but then checked that they did not use scenarios that represent a diversity of gender identities. So they're like, sure, anyone can use it, but the only examples reflect a certain gender makeup of the perpetrator and the victim. So that raises questions about like, what do we mean by inclusivity? And we weren't super clear, like this is just the question we asked. We didn't define, here's what we mean by inclusive. So that kind of left some room for their understanding of what inclusivity means to inform their answers.
Yes, thank you. That's a great point.
Are there any questions on the logistical information that y'all wanted to add to the chat before we move to the next piece? And I also added to the chat, I'm seeing a few questions, and someone asked about the materials. So the matrix is already available for download at NCCASA's website, nccasa.org. And then if you click on our work and go to the prevention page, the matrix is listed under our prevention resources. It's also on our human trafficking page under those resources. The workshop that we'll be doing in May, which will be on how to create an evidence-informed curriculum, is going to be at NCCASA's biennial conference. So I'm not sure if registration is open for that yet, but I know that we have our call for proposals out if any of y'all want to put in a call for proposals, and that as registration is ready and the lineup for that conference is available, it'll be available on our website and posted on our social media. And then I also added in the chat, I know Madison mentioned we use Teach to Reach's list of protective factors, and that was partially a matter of convenience because NCCASA's staff are on the Teach to Reach team, and so we knew the process of research through the literature that had been used to develop that list of risk and protective factors. You can download a simple graphic, which you'll see a little bit later in Madison's presentation, of the risk and protective factors worksheet that Teach to Reach made. But that came from the systematic review of the literature that was done by Hannah Beth Franchino Olson and published in Trauma, Violence, and Abuse in 2019. So if you want the simple handout version, you can get that at Teach to Reach's website. And if you want the academic paper that developed that list, it's in Trauma, Violence, and Abuse in 2019 by Hannah Beth Franchino Olson.
The next two slides are actually both part of the logistical information that we gathered from the curriculum developers, but we believe survivor involvement and evidence-based are extremely important and therefore deserve like us to dive deep into them. And so in the matrix development questions, we asked about the level of survivor involvement in the development of the curriculum. Survivor involvement ranged from level 1, curriculum was developed primarily by survivors. Level 2, survivors were on the team that developed the curriculum. Level 3, the curriculum was reviewed by and incorporated feedback from survivors before being finalized. And level 4, survivors were not directly involved in the development. And curriculum developers were able to select all that apply. So maybe level 1, the curriculum was developed primarily by survivors, and also level 3, the curriculum was reviewed by and incorporated feedback from survivors before being finalized. In asking them this question, only one human trafficking prevention curriculum was developed primarily by survivors of human trafficking. Of the 14 curriculums, 7 had survivors on the curriculum development team, and 12 of the organizations noted they at least utilized review and feedback from survivors. There were 2 organizations that did not involve survivors in the development or creation of their trafficking curriculum. Curriculum that represents the experiences of survivors and that can influence the risk and protective factors noted in sex trafficking research that were identified by survivors is crucial. So a curriculum that includes survivors in the decision-making process and implements their recommendations will better create an informed approach to addressing risk and protective factors. Additionally, a curriculum should consider that not all survivors share the same beliefs and experiences. And so there are benefits to listening to a diversity of survivors that have had different experiences in trafficking, keeping in mind that being a survivor is a description of someone's relationship to an experience, not a skill set or professional knowledge base. And so involvement of survivors exists among a spectrum from, and you can see that we have this spectrum of survivor input here on the right. And so it ranges from informing, consulting, involving, collaborating, and empowering. And so at the bottom level, your program will keep survivors informed about program development and decisions affecting their care, ranging to empowering. Your program will leave final decision-making power to survivors and will implement the recommendations, strategies, and decisions that they develop. One organization, the Prevention Project, additionally noted that in their annual review and updates of their curriculum, they consult survivors throughout the process and receive feedback so that each year they are evolving and taking into consideration the experiences as their curriculum improves each year or develops based on research and evidence. And in reflection of this entire project, we would have liked to include a question for each curriculum asking about their review process and the extent to which they incorporate the evolution of human trafficking prevention curriculum and the role of survivors in their review process. That what Prevention Project noted that themselves in a written response, but we did not explicitly ask. But it would have been helpful in understanding their continual program improvement based on their relationships with survivors and their experiences.
And that's something where I know, as Madison mentioned, that Prevention Project, including written feedback about their process for review and continual improvement, kind of cluing us in that would have been a good question for us to have included. Another thing that tipped us off to that was one of them whose answer was that survivors was not involved in the development of the curriculum at all. And then they added a write-in response that at the time that they created their curriculum, I think 12 years ago, it was not the norm to involve survivors in the development of curriculum, which then we were like, they haven't reviewed it in 12 years. So that was like, oh, we should have asked about, do they have a process for review? So in selecting your curricula, that might be something you'll want to know that we didn't include in this matrix. Do you have a process for continual quality improvement? Are you evaluating and improving, and what is your process for continuing to make sure your information is current? What does that look like? And again, I just want to raise up what Madison said about including a diversity of survivors. If you have a program that was developed by a small number of survivors who had relatively similar trafficking experiences, maybe they were all trafficked using a romantic pimp model of sex trafficking, then that curriculum will be very effective at incorporating survivor voices for that specific kind of trafficking, but it might not be as inclusive when we consider the variety of ways that sex trafficking can happen.
I'm good for the next slide, Chris. And so then another really important aspect of development and monitoring was looking at the evidence base of each curriculum. And so we asked curriculum identifiers, what is the evidence base for your curriculum, and included the definitions you see on the right. Answers ranged from prospective practices, meaning this curriculum has not yet been formally evaluated, or we are currently working on our evaluation strategy. And so this would be a curriculum that has not considered a monitoring and evaluation approach when developing their curriculum, or maybe they have, but they haven't fully developed the strategy. And so once a curriculum has decided that we would like to become more evidence-based, they move into the emerging practices evidence. And so the curriculum is based on guidelines, protocols, standards, or preferred practice patterns that have been proven to lead to effective public health outcomes, incorporates a process of continual quality improvement, but does not yet have sufficient data on effectiveness. And so maybe this curriculum has done a literature review. They have taken in consideration the research that exists and the evidence that exists regarding best practices for sex trafficking prevention. They have considered other standards or protocols that exist and have begun to think about how can their curriculum fit within this evidence, and hopefully in the future look at ways in which they can effectively evaluate or monitor their own curriculum in order to ensure that they are upholding the evidence that already exists. And so once a curriculum decides that they want to have their curriculum begin to be evidence-based by monitoring and evaluating their outcomes, they are looking at being a promising practice. And so this curriculum has strong quantitative and qualitative data showing positive outcomes, but does not yet have enough research or replication to support generalizable positive public health outcomes. And so maybe the curriculum organization has started to collect quantitative and qualitative data showing that there are effects, positive effects of their curriculum, but it doesn't yet have enough evidence to say that this is evidence-based, this is the top curriculum that exists. And so a curriculum that is evidence-based has been reviewed and substantiated by experts in the public health and/or education field according to predetermined standards of empirical research. And so being evidence-based means that there are studies about the successes of your program. It shows that based on predetermined indicators of monitoring and evaluation, your curriculum has proven to have an effect on the risk and protective factors leading to increased vulnerability of sex trafficking. It helps students or children or adults be less vulnerable to being a victim of sex trafficking, and it shows that based on quantitative and qualitative data, you are the most evidential. And so with asking curriculum developers this question, we did give the definitions, and we received a variety of responses. At this time, My Life, My Choice is the only program that is evidence-based. With that being said, as I said earlier, My Life, My Choice is gender specific for adolescent girls only. It focuses primarily on one specific model of sex trafficking and is designed to be co-facilitated by a clinician partnered with a survivor leader. And so logistically, this could be difficult to implement in district-wide. And although the curriculum is the most evidence-informed, it still produces its own barriers to implementation. Not a Number was an additional program that has some peer-reviewed published studies about its effectiveness, making it a promising practice. And while there's only one known evidence-based curriculum, My Life, My Choice, 3 programs indicated being evidence-based when we know that they are not, and over half indicated being a promising practice. And so the survey responses demonstrated maybe a lack of understanding of what indicators are measured by, of what indicators are, or how violence prevention is measured and evaluated, and truly how to become evidence informed. One respondent noted the impossibility of accurately measuring who avoided being victimized as a result of receiving their curriculum in the write-in response following this question, and pointed to a high number of referrals that their program continues to receive as evidence of effectiveness. And while it is great that a curriculum, people like it in the community and it has support from the community, that does not make it evidence-informed or evidence-based. And so that also goes to show that there's a lack of understanding of what an indicator or a measure should be when you're looking at how to become evidence-based. Just because you find success maybe in a referral protocol doesn't mean it is evidence in lowering rates of sex trafficking, or maybe you've created an indicator about reducing the amount of time spent on social media. That doesn't go to and it works. Your program helps children spend less time on social media. While it was effective and you found a positive outcome, that doesn't mean that you are successfully becoming evidential or measuring your impact on rates of human trafficking. And so there's a need for education within the human trafficking prevention field about the process for creating and evaluating evidence-informed curriculum, the kinds and levels of data that are needed for evidence, how to secure an independent evaluation of a program's and evidence-informed status, which we will be covering in our biennial conference training, and hopefully it will help curriculum developers in guiding their program to become evidence-based. I also want to point out that in creating a curriculum, it can be difficult to take your work and create a monitoring and evaluation plan after you've already created the curriculum. And so in the future of the anti-trafficking movement, it's really important that we begin to solidify the relationship between monitoring and evaluation and curriculum development so that they're occurring at the same time. And so that hopefully the future of the movement is that being evidence-based is the standard, being a promising practice with research and quantitative and qualitative data is the standard, and that we don't have to go backwards to create the evidence base after we've already been implementing the curriculum in schools and in organizations. Ultimately, we did not include the responses to this question in the human trafficking matrix because of the potential negative impact of declaring a specific level of evidence when some respondents' self-reports did not align with our knowledge of the evidence.
And that's something where I can add just a few thoughts. One of them is like having one peer-reviewed, which again, My Life, My Choice has several peer-reviewed papers that have been published, so it's definitely evidence-based. But even for the curriculum where there's one journal article we could find that was peer-reviewed and published, that moves it into promising practices. So to our knowledge, there's one that's promising practice and one that's evidence-based. There's several that are emerging practices, but they all rank them kind of differently. And some of them that were coming out of university teams who are really, really familiar with this framework were saying they're an emerging practice when they may be more rigorously aligned with the evidence and public health about prevention than other ones. So it takes more than one research study. So for starters, it needs to be like a peer-reviewed research study for promising practices. And then it takes multiple of those, still replicating it, showing positive outcomes, even when implemented in different settings. Then it's evidence-based. The other thing that we find is when it comes to creating an emerging practices curriculum, that's where you start with the guidelines, protocols, and standards. You really do your research, not just on human trafficking, but on like, what is violence prevention supposed to be like before creating your curriculum, or at least you do a revamp of your curriculum to really align it with those practices. And one of the things that we've heard a lot through the course of creating the matrix and in other work at NCCASA is people saying, well, there aren't best practices for human trafficking prevention because it's so new. But the reality is the CDC has guidelines for violence prevention. And I put, I mentioned in the chat a couple of resources that the CDC has guidelines for violence prevention. And while they have some specific guidelines to sexual violence in the Stop SD technical package that tells you what sexual violence prevention should look like, they also have a lot of research that's just on broad general violence prevention. So a lot of what we do in sexual violence prevention is using the same foundational best practices principles that are used in partner violence prevention, teen dating violence prevention, child abuse prevention, elder maltreatment prevention, because violence prevention is violence prevention. There might be minor differences, like differences in your risk and protective factors you're addressing, But there are best practices for violence prevention. This isn't something new that we have to reinvent the wheel. Go look at what the CDC is saying for other forms of violence prevention, especially when we talk about sex trafficking, because sex trafficking is a subset of sexual violence. Sex trafficking is a form of sexual violence, and we have norms and best practices for sexual violence prevention. So anyway, let me mute myself.
So the next section of the matrix is about the content that each curriculum includes. And Chris, I welcome you into this conversation as well. As we discuss how content, the content of the curriculum informs us about the information on the specificity of the curriculum and the key information that the curriculum is trying to offer and that is targeted. And so this list was created based on what Chris was just saying, things that we know exist in evidence and research regarding violence prevention, sex trafficking prevention strategies. And so looking at the content, these were check all that apply. Does your curriculum address building empowerment? Does it help your students find their voice in their relationships among their friends? Does it empower them to have autonomy about their own personal decisions, about who they choose to be in relationships with? It looks at the identification of healthy relationships or relationship red flags that could arise, and looks at consent, addressing experiences of relationships in which there may have been a trust factor, a close romantic relationship, and then that trust was broken, and teaching students mechanisms for maintaining their personal choice in relationships, and how to be aware of when healthy relationships turn unhealthy.
And all of those, the building empowerment through consent, those are drawn straight out of sexual violence and partner violence prevention best practices, and what other curricula are doing in sexual and partner violence prevention, teen dating violence prevention. We know that educating on these topics is a best practice in those forms of violence prevention, and that a lot of these, especially when we look at romantic partner trafficking, exploitation, that these are factors that can help. And it's not that we're educating someone to think that they're going to be safe and they can protect themselves against a manipulative adult, but it might help them recognize what's happening with their friends, and be able to like shift the cultural norms by empowering people with information. We also included a question about labor trafficking. Does your curriculum address labor trafficking? And to be clear, the North Carolina law that mandates the trafficking education only mandates sex trafficking prevention education, which is tricky and also reflective of some of the political pushing behind getting this law passed. So labor trafficking is not required in the law, but we did ask whether it addresses labor trafficking, because that may be a priority for a school who wants to make sure that their children are protected from a variety, or have information about a variety of different kinds of trafficking that can happen.
Yeah, and actually, as far as labor trafficking, only slightly more than half of the curriculums did address labor trafficking within their curriculum. Looking at bystander intervention, or the role of structural factors in trafficking vulnerability. So looking at food access, housing, etc. Being homeless puts you at a higher vulnerability to sex trafficking experiences. And the relationships between homelessness and sex trafficking also leads to the relationship between labor trafficking, and that one study of homeless youth in a Covenant House shelter found that women were more likely to experience sex trafficking while men were more likely to experience labor trafficking. And so considering how the role of structural factors then creates opportunities for different levels of trafficking. Looking at online safety and recognizing false job advertisements or false opportunities, the ability to distinguish, is this a true job opportunity, or is this something that I can feel safe partaking in? and again, giving the individual autonomy. Responding to disclosure of suspected trafficking, this also aligns with the requirement that there needs to be protocol for responding to disclosure of suspected trafficking among the school administration. And then looking at how to access hotline and local resources, we can build the knowledge base for students about what to be on the lookout for or how to be best informed. But also, if a situation does arise, do you have the resources for being put in contact with support and help in your community?
And that's really important. I know at NCCASA, when we get invited to do stuff, we won't do something unless they've got local resources available. So even with presenting to adults, if someone invites me to come and present to adults in a community, I want to know who's your local rape crisis, partner violence, human trafficking, child advocacy, who are your local programs, so that I can make sure if someone needs support that I don't go in there and just drop this information that brings up a trigger or causes someone to recognize a trafficking situation without preparing them with how to get support that they need. So that and the responding to disclosures are two of the pieces that not all of the curricula included, but that we think are important if it's not in the curriculum, to make sure that a school or whoever's delivering the program is ready to handle that when it comes in. And then we asked about gang affiliation, because we noticed that that was something that a lot of the curricula tried to address. And I think I want to jump in with a couple of these other things on the online safety. I wanted to note that there's a really great research article that I will try to find and drop in the chat in a little bit. But one of the things that we've noticed about online safety is that a lot of times curricula, and we didn't ask about this because this is way more of an in-depth study than we did with this matrix. But I've noticed from different curricula that some of them take here's how to keep yourself safer online, here's how to do boundaries online, but then some of them do this whole the internet is the Wild West and very scary approach. And while to many of us, A, who are older, but also B, who work in this field and get to see some of the worst things that can happen, the internet does feel a little bit like a Wild West. But for young people, that messaging does not resonate with them. They do not hear that. I mean, to them, that's the same as us saying, don't walk out your door. It doesn't feel realistic. And so there was a survey recently done of best practices for internet safety. I think it's called Youth Internet Safety Education, Aligning Practice with Research or something like that. But anyway, what it showed in this aligning it with the research, with what the best practices say, is that you don't want to do online safety as its own category. So you don't want to be like, here's how to set boundaries, here's how to receive boundaries, here are relationship red flags, here are healthy relationship signs, here's what grooming looks like, and here's the internet safety unit. What you want to do is offer examples and role plays and scenarios of how each of these topics might happen in DMs or on social media or in the comments section throughout it. So if you're talking about how to tell if a relationship's healthy, here's signs of healthy relationships, and you give them 10 examples, well, then you might want to make sure that 3 or 4 of your healthy relationships examples describe online interactions. If you're talking about relationship red flags and you give them 6 scenarios to kind of see if they can find red flags in them, make sure that some of those scenarios include examples of red flags that are happening through DMs or online or in someone's profile. So the best practice in online safety, just FYI, I found this very fascinating. I like to read research and share what I'm learning. But the best practice in online safety is not to do like an online safety unit that kind of frames the internet as some weird other. But rather to include that information throughout your other kinds of safety and relationships education that you do as just an everyday part of how they navigate boundaries, healthy relationships, notice red flags, know what power dynamics look like, because that's how young people especially experience online interactions, is not as its own separate thing, but as yet another way they engage with people in their lives. Let me see if there's anything else I wanted to mention. Yeah. I did want to note too, Madison mentioned the Covenant House that showed that boys are more likely to experience labor trafficking. that one of the things that was interesting to me in the Covenant House study is that of the boys who experienced labor trafficking, do y'all want to take a guess at what the most common industry young adult and teenage and adolescent boys were trafficked into? Does anyone know from that study what it was? No, although I'm sure there's a lot, especially in North Carolina, there's probably a lot of farming. I see someone mentioning. It's drugs, drug sales, drug mule, moving drugs. So it's another criminalized economy. And one of the things that is the result of that is when we don't do some of this education, not just of youth, but of our school staff, of our law enforcement, of our providers around the fact that a lot of what we tend to just think of as criminal activity among youth or youth violence or gang involvement is actually labor trafficking, but we don't recognize it as such and see the powerful impact of those grooming practices, power dynamics, that creating a sense of family and belonging. So, you know, again, we're moving back to the fact that the mandate was for sex trafficking prevention and not labor, when a big piece of the labor is also in criminalized economies and happening to vulnerable youth. But because of historical and racialized expectations, those youth who are labor trafficked in criminalized drug economies are seen as criminals and not as victims of that trafficking dynamic. So I'm a big advocate for expanding safe harbor laws to cover labor trafficking of youth where they don't. I'm a big fan of expanding education to include that labor trafficking of youth, because I feel like there's some very real and, to be honest, racially motivated reasons why those victims aren't prioritized in the same way.
Yes, thank you for chiming in there with your knowledge on the subject. And so then the third main major section of the matrix looks at risk and protective factors for trafficking. And so on the left, we have the social ecological model. This model illustrates the interconnectedness of social elements across the lifespan of an individual. And so looking at the model, we can see that the individual level is surrounded by the relationship level and community level up to the societal level. And so each level operates within and is influenced by other levels in the model. And risk and protective factors for all health outcomes exist within each level, but also specifically with trafficking. And so risk factors are factors that increase the likelihood of violence occurring, even if they are not causal. And protective factors are factors that decrease the likelihood of violence occurring or increase resilience. And so breaking down the levels of the SEM, the first level, the individual level, identifies biological and personal history factors that increase the likelihood of becoming a victim or perpetrator of violence. And so these look at factors such as age, education, an individual's income, attitudes, or beliefs, the past trauma, and mental health history. The second level, the relationship level, examines the relationships of an individual that may increase the risk of experiencing violence as a victim or perpetrator. So relationships with your family, relationships with peers, partners, or other social networks that closely surround the individual and have the ability to influence an individual's, the individual factors we saw on the level before. The community level explores the settings in which social relationships occur and seeks to identify the characteristics of these settings that are associated with becoming victims or perpetrators of violence, such as neighborhoods, schools, the workplace, social or religious organizations. And as we can see, as we work up, like the neighborhood that you live in or the school that you attend will influence your relationship. So influence your peers or possibly your partner, which then works down to the individual level. And at the most outward level, the societal level looks at factors that help create a climate in which violence is encouraged or inhibited. And so there are factors within each level of the socio-ecological model that contribute to an individual's risk or protection against sexual violence or trafficking. And because of that, prevention strategies should aim to address factors within each level. And the most sustainable education curriculum or programs are going to consider factors that exist throughout all levels and address from societal down to individual.
Yeah, and that's something that we see a lot in some of the more effective sexual violence curriculum that are out there, is that they'll have a curriculum where they teach kids things like healthy relationships, relationship red flags, what grooming looks like, how to intervene, but then they may also have like a community level thing, like a social media campaign that the young people coordinate themselves and implement themselves, or a poster campaign that gets implemented throughout the school. Or something like, and this isn't necessarily going to be the same as in trafficking, but in other forms of partner violence, bullying, sexual harassment, they may have the students fill out a map of their school with red, yellow, and green for the areas that feel safe, kind of unsafe, or areas where they've experienced harassment. And then they can generate a map of the school to give to the administration and say, here's the areas that students consistently feel less safe in. So be creative, and I'm not sure exactly what that would always look like, but be creative at how you can, if you're doing a curriculum that addresses relationship and individual factors, be aware that some of the best research supporting evidence-based partner and sexual violence curriculum comes with the curricula that also have a community and society level to sort of supplement and sustain and create the container for some of that individual and relationship level change.
Yeah, and so just going off of what Chris was just saying, the goal of primary prevention is to reduce risk factors, increase protective factors at all levels of the social ecological model to create sustainable change. And so using the social ecological model, this is a more specific version created by Teach to Reach, looking at risk factors for experiencing sex trafficking. Looking at the social ecological model here, we see that there are risk factors for sex trafficking within each level of the model, from individual to societal. These risk factors have been identified to increase a youth's likelihood of experiencing sex trafficking, but they are not causal. And that's really important to keep in mind, that not all youth who experience these risk factors will experience risk trafficking. They instead demonstrate an increased vulnerability. For example, looking at the relationship level conflicts with parents. Conflicts with parents or compromised parenting will heighten the vulnerability to risk factors for sex trafficking. But we cannot say that conflicts with parents causes sex trafficking experiences. You can be a child who experiences parental conflict without experiencing sex trafficking. So saying that risk and protective factors create associations but not causal relationships between the factor and sex trafficking. So in creating prevention strategies for sex trafficking, the goal at the relationship level, if you're looking at conflict with parents, maybe to decrease conflict with parents, decrease that risk factor, and instead create solutions that promote positive parent-child communication about maybe some of the content we discussed earlier, such as online safety. So decreasing the risk by promoting protective factors. And so by providing the risk and protective factors addressed by each curriculum, school administrators, when comparing the curriculum in the matrix, can ask important questions based on their district needs. Like, which risk factors do we feel are more important to look at in our community? Which risk factors does this curriculum address, and how does it aim to reduce them? Or which protective factors does it address, and how does it aim to increase them? And so does it address multiple levels of the social ecological model, like looking at community and societal, or does it really just focus on the student maybe and their individual behaviors and relationships?
And just this is sort of like a spoiler alert for any future trainings we do on how to evaluate and create an evidence-based sex trafficking curriculum. I know Madison mentioned earlier that someone replied, we can't measure who didn't get trafficked as a result of receiving our curriculum. Therefore, how do we measure this? I just want to give you the spoiler, which is that these things are what you're measuring. What you want to do is look at your risk and protective factors and measure the degree to which your curriculum has a meaningful impact on reducing risk factors and increasing protective factors. How much are you shifting people's beliefs about these social norms that contribute to trafficking? How much are you reducing the glamorization of pimping or the stigmatization of sex work? How are you looking at, like Madison mentioned, promoting positive relationships with trusted adults and parents? So that's what you're going to be measuring, is how does your curriculum impact risk and protective factors?
And then in brief, and we'll take a bit of a look at this also when we look at the matrix itself, but we had a lot of highlights of things that we are proud of in completion of this project, but also lessons learned in the work that we did, and also for future variations of this matrix or for other states that decide to create a matrix similar. And so in completing the development of the matrix and in understanding the survey responses, we found these few highlights. First, we acknowledge that there has been great evolution in human trafficking prevention curriculum. And with that being said, the curriculum that's included in this matrix ranges from the early 2000s to most recently in 2020. And while we do not aim to evaluate the curriculum that we decided to choose or that were included in this matrix, we do know that human trafficking education and strategies for prevention have evolved tremendously based on evidence and research in the last few decades. And with that being said, one respondent of the survey indicated that the program that they were providing had not been updated in over 8 years of use. And that can be potentially extremely harmful. For example, the curriculum chosen 2012, which is not included in our matrix, consists of 2 videos and supplemental materials. And we attended a stakeholder viewing of this curriculum. And there are scenarios that represent outdated stereotypes or experiences of human trafficking. And Chris participated in the most recent stakeholder viewing, so I'll let them share some of the reflections that stakeholders had to share about that curriculum.
Well, I know we hosted, NCCASA hosted a special invitee only viewing of Chosen, where we invited statewide leaders in the trafficking movement to come together and view both Chosen and the Chosen Gang Edition together and share in dialogue. And it was very interesting what a variety of feedback we got from it, to where some people were like really noticing some ways in which the way it talked about trafficking was dated, the way it talked about violence prevention wasn't in line with public health norms. And then there was also some people who just were really excited about the curriculum and how for certain audiences it might be great, but I think the broad recognition was that it's not as inclusive racially or in terms of representations as we would hope that it would be. But it was really interesting. We called our screening of it a celebratory critique, because the fact is we start somewhere, right? But it was an opportunity to watch this older curriculum and just really reflect on how much the movement has changed over the past years since Chosen was created.
Yeah, and examples such as that re-emphasize the importance of survivor involvement and a thorough review process that contribute to the evolution of human trafficking prevention curriculum. Secondly, we did note that the survey responses relied on self-report and interpretation of questions. And with that, there's possibility of bias or misinformation based on the one person that filled out the survey. There's the possibility that the respondent may have interpreted a question in a way other than it was intended, which may have influenced their response. So for example, when we asked curriculum developers to note the presence of risk or protective factors in their curriculum, some respondents may have only checked off boxes of those risk or protective factors that they explicitly name and have an explicit example about, as opposed to some may have checked it if it's something that they broadly discussed or is used through examples and discussion points. And so we have to consider that in looking at the responses that we received. And finally, we did ask curriculum developers to note any content or factors that we did not ask them about, but that they utilize in their curriculum. And so this provided information for content that we may wish to look at in future variations of this survey. So human rights, past abuse, pornography, social media, empowerment, and childhood trauma. And so we note that future variations of the matrix may want to recognize these aspects in their survey and subsequent resources. And so I'd like to pause, and before we jump into the actual walkthrough of the matrix, does anyone have any questions or anything that they'd like to add based on the presentation so far? Okay. So I'm going to take some time to actually walk through the matrix and consider how schools can use this tool to help them identify a human trafficking prevention curriculum that would best be fit in their community based on their school's needs and their community's needs. But before we begin, Chris, you can go to the next slide. I'd like to do a little activity. And so in the chat, based on what we've discussed today so far in the presentation, if you could name a few aspects of a new curriculum that you would believe to be important for your district or organization. And they don't have to only be things we have chatted about thus far. For example, my mom is the assistant principal at our local high school, and I know that our community is really involved in the decisions made in the school. And so maybe a school would need to consider community support or parental buy-in. And so just considering factors that may influence the elements of a curriculum you would wish to choose. So if everyone could maybe think about a few and maybe put some in the chat.
So someone is saying inclusive. I'm seeing able to be included or adapted in an already established prevention curriculum. Yes, if you already have a prevention program going, how can we incorporate this into what we're doing so that it's still manageable capacity-wise? Something that can be taught in mixed gender settings, someone is saying. What are some other things that are priorities for your organizations? For me, I'm kind of thinking my answer might be something like something that's got like the right balance between informed by the evidence and flexible for, you know, adaptability in different settings, like finding the right balance between being grounded in the research and still flexible. Anyone else? Yeah, it can be easily adapted to present online. That's especially important right now during COVID. Yeah, that's a big one.
Yeah, those are all really great points. And so that's kind of the idea with schools, is they have the knowledge in their administration and their community about things that are important for their curriculum, important to their community. And with that in mind, they can open the matrix and have the ability to make an informed decision based on the resources that are provided.
So I'm going to stop my share long enough to share with you the matrix itself. Let me see if I can bring it up here. So we'll kind of walk you through it. And Madison, I'll let you talk and just tell me when to scroll.
Perfect. And periodically we'll stop in case anyone has questions as we go through it, but also feel free as they arise just to put them in the chat and we can talk about it as we go. And so this is the table of contents for the matrix, just broken down by the curriculum and what page you can find their logistical information. So the development and implementation by content, risk and protective factors, highlights lesson learned, and then contact information so that schools can reach out to the curriculum developers themselves. Chris wrote a really great letter talking about the development of the tool, the overview of the tool, our intentions behind the resource, and how it can be used by schools. And so this is the first main portion of the matrix. And so as you can see, there's a section for each of the 14 curriculum that are included in the matrix. And these are all the questions we discussed as far as the development of the curriculum itself. And so we can see the first question, survivor involvement. There's a key at the bottom of each page where it tells you the level of survivor involvement in the curriculum. There's questions about who delivers the curriculum, with answers ranging from curriculum developers, faculty and school support staff, or it's available online, as someone had brought up would be really important for their district. And so like this will just help the schools to say, hey, we already have health education classes and we'd love for it to be administered in those classes. And so it'd be best if it could be taught by school staff. Its intended audience ranges from college students, parents, caregivers, school staff, and administrators, elementary school, grades, and then format. So similarly, if you knew you wanted to teach it in health lessons, maybe it can only be an hour each or 45 minutes each. And the format is how many sessions are included and then how long they would be, as well as the materials and how it is delivered. So electronic self-guided modules, in-person activities and training, and then the languages it is available in. And we can see that for the one we're looking at right now, child sexual abuse and commercial sexual exploitation of children, it's available in English and in Spanish, but the one above it was one of the ones that had the most inclusive language variety. And then looking at costs associated with the curriculum. So the one above, there was no cost at all. It is free if you reach out, possibly just available on their website. But the one below, there's a cost to receive the curriculum. There's a cost to purchase the curriculum or the licensing for the school. There's a cost to train those who administer the curriculum. And you have to purchase additional materials for the curriculum implementation. And so for some schools, if they don't have an allocation of funding in their budget, that just might not be feasible. Is the curriculum gender inclusive? So that was just check all that apply. And each curriculum has the ones checked that they checked, faith-based, and then protocol for responding to student disclosures, yes or no. Does their curriculum include this protocol that is mandated by the state, or would you have to develop or create or find that on your own?
And I'm just kind of giving you a moment to look. Y'all can get the toolkit itself at NCCASA's website by going to nccasa.org. And then if you go to our prevention page, the matrix is linked there, and also on our human trafficking resources page. But I'm just kind of giving a little bit of a scroll here. You can always look at it yourself. But this gives you an idea of what we're doing in here. The one unique thing I will say about Teach to Reach, and I'm not just saying this because I'm on the team that created it, I did help write it. So there's a disclaimer, NCCASA was involved in that one. But one of the things that is unique about Teach to Reach is that it was, in addition to being aligned with the evidence and having a ton of research going into what violence prevention norms are, it was also aligned to North Carolina's health standards. So if you're in North Carolina, that's a plus. It already is aligned with the NC Healthy School Standards. And if you're not in North Carolina and you're on a team creating curriculum, that might be a consideration, is to look at what does each state's health criteria in the Department of Public Instruction already mandate be taught. And if you can align it to meeting healthy standards that are already in place in the schools, it will be more easily rolled out in health classes in a school setting.
The next section looks at the curriculum content, so the aspects of what is included in the curriculum. And so this is done in a chart format and checks under each content piece that was included. And so you're able to look up and down the chart and see, you can compare bodies are not commodities to Born to Fly, for example, and bodies are not commodities does address building empowerment and healthy relationships, but that is not something addressed in Born to Fly. Keeping in mind that we did say that this may have been interpreted differently and by each organization, maybe they didn't explicitly address it, but it's talked about in examples, but just keeping in mind that's how they may have responded. And then this is continued, the other half of the curriculum content chart. And then the risk and protective factors section. And this is broken down into charts of individual factors, relationship, community, and societal. And so this is the factors for risk factors for sex trafficking that was adapted from Teach to Reach for this project. And then we also included, as I mentioned, adherence to gender norms and hypermasculinity as they were listed by the CDC as risk factors for sexual violence.
And here we have the relationship level risk factors that were in our chart that we identified. And here are the community level risk factors, so you can see which ones might be addressed in any way. And then we have societal. And the CDC is pushing more and more and more towards community and societal level prevention. If you're paying attention in violence prevention norms, they're now at a point where, for like an example is our rape prevention education, which is the CDC fund that funds sexual violence prevention. They're mandating a lot of community and society level prevention. And there are even some prevention organizations that are starting to focus almost exclusively on community and society level, because we're recognizing more and more that we can give children education all day long on how to protect themselves, but if we're still not fixing the societal and community conditions that create vulnerability, we don't train children on how to protect themselves from parental physical abuse, or we need to be looking at how we can change the conditions. And so a lot of the CDC funded prevention strategies are being pushed towards those, changing those community and society level factors.
And then this page we asked the curriculum developers, does your curriculum address risk factors for perpetration? And only 8 of the 14 curriculum noted that their materials do address risk factors for perpetration in any way. One organization noted that they discussed the risk factors for perpetration in their training curriculum for school personnel, but only slightly address or mention it in their youth curriculum. But with that being said, many of the curriculum responses may not have known that often risk factors for perpetration are many of the same known risk factors that exist for sexual and other forms of violence. And that goes with saying that, again, we were relying on the responses from the people we were in contact with.
Yeah. So a lot of times, some of these same risk factors that create increased risk of experiencing it can often be the overlap. They might be some of the same risk factors for perpetrating.
And then we have the review highlights, and the next page is the lessons learned, which we covered briefly in our presentation. And then this is a contact sheet for all the curriculum included with linkage to their website by clicking and contact information.
And we may try to find, now that we're not sharing the screen, I can find some links for you. I know I wanted to check that link that Robin put in there earlier about that journal article, but if y'all have any questions for Madison, I know that this is a how to choose a curriculum. And so we're kind of like walking you through the things. When we created this matrix, our question was, what would we want to know to choose a good curriculum? So our goal today was to walk you through each of those things that we considered and explain why those were important factors in our survey, because we believe those are also important factors in choosing a curriculum that both fits your needs and is going to be effective. So are there any questions from Madison?
I also want to add, if before we end the call today, we'll share the final slide with you that has both my email and Chris's email, and questions are always welcome after. And I'm new to the presenting world in general, so I'd welcome any feedback if anyone had any as well.
And I'm going to share the slide with your contact info as soon as I get the prevention page up so people can access the matrix themselves. as well as our other prevention resources. We also have a human trafficking prevention toolkit that sort of walks you through the social ecological model, public health approach to preventing human trafficking. So yeah, let me find the slides and we'll share that last slide. Guess I need to get to the right tab. Give me 1 second. And let me look at the chat and see what questions we may have in the chat. Yeah, so thank you, Madison. I just want to thank Madison for doing this. Madison is, as she mentioned, still a student and just did a really amazing piece of work on this matrix. One of the things we're hearing is that there's not really a whole lot of documents out there like this in other states. And again, we only evaluated curricula that were available to be used in North Carolina, since our focus was to create a tool for North Carolina schools. But this is sort of a model for how to evaluate what curriculum might fit people's needs and kind of put it together in an easy to access document format. Feel free to reach out to either of us if you have questions. Are there any more questions? All right, well, thank you so much for joining us today. And if any questions come up, feel free to email us. Check out North Carolina Coalition Against Sexual Assault's prevention page for a lot of good prevention resources. And we do also have a human trafficking page on our website where you can also find Expanding Our Reach, which is a pretty thorough manual for rape crisis centers to better serve survivors of trafficking. And also follow us on social media at NCCASA to find out when our biennial conference registration is open and also to see the other resources and trainings that we have available. Thank you so much for joining us today, and I hope y'all have a